Kyphosis versus posture, or posture versus kyphosis. I have seen recently a lot of providers, therapists, trainers tell patients, especially with upper cervical instability, we need to fix your posture or your curve. And they confuse the two. I did write a few papers, one in particular on improving the cervical kyphosis, improved upper cervical instability. And now a lot of people are suffering with upper cervical instability or CCI or CCJ. And then a lot of people are saying, hey, I can fix that for you online with postural exercises. Now, you can have what's called anterior head translation or a positive CSVA, which is significant anterior head translation, like someone looking on their phone. Just because you have forward head posture doesn't mean you have a kyphosis. And even if you have what appears to be from the outside good posture, doesn't mean you don't have a kyphosis. Changing these two or interchanging them, so to speak, is inaccurate. Now, if you're seeing a therapist or a provider that says, hey, your head is really far forward, we need to work on your posture, and you're doing postural exercises from a therapist that hasn't looked at your images, there's really no way to tell if you're fixing the kyphosis. Now, if you want a very quick way that if your posture is really bad and they're giving you all these strengthening exercises, look, it's super easy. And we give lots of exercises and home exercises and online exercises at Cat's Chiropractic that you can monitor and follow to see if you're getting stronger. But the best way is just right here, your episternal notch, just try to touch the ceiling. That's what's going to help. We see people all the time like, oh, my head is forward and I'm giving exercises to squeeze my shoulders back. You shouldn't have to squeeze your shoulders back, because if you squeeze your shoulders back, your head is still forward. And now you're just making the posture worse. So start to increase just postural exercises. But if you have a true kyphosis, the treatment has to be specific with a specific chiropractor that's trained mainly in chiropractic biophysics. That is what's shown in the literature to fix a kyphosis. I would love to fix your kyphosis online. I'd be busier. But I'm not going to do that, because if you have kyphosis and instability, there's exercises that I can give you to help. But we have to look at what the research shows on how to really try to improve that kyphosis. And in the papers that we did with improving blood flow to the brain, happened to do with kyphosis and was not posture. And the same thing when we fixed the kyphosis to minimize upper cervical instability. That was fixing the kyphosis, which ultimately improved the posture, but it wasn't just a postural deficit. A true kyphosis is a true structural and biomechanical problem that needs a true structural and biomechanical solution in the ligaments. And the exercises are fantastic. And I give all our patients exercises and home exercises, but there needs to be something done to address the true structural aspect. So abnormal posture and cervical kyphosis are not interchangeable. You can have one without the other, and you could have both at the same time that could require different types of treatments and different types of outcomes and solutions. So please, patients, stop falling into the trap of therapists online that says, I can fix your kyphosis, when they haven't looked at your imaging. They're not trained to look at your imaging. They haven't measured your imaging, and they're not truly assessing if it's your bad posture or if it's a kyphosis. Now, posture should always be worked on and improved. But just because you have good posture doesn't mean you don't have a kyphosis. We see patients that their posture looks good, but their neck is incredibly buckled on imaging and on DMX. And then what we do in our office, if you have abnormal loading on true DMXs, 30 frames per second, measured, we can give you exercises to determine if that exercise makes the condition worse or better in the mid-phase range of motion. So again, just understand what you're getting treated for, and please stop confusing and interchanging posture and cervical kyphosis. They're not interchangeable, okay? So if you have any questions, please reach out to Katz Chiropractic in Boulder, Colorado, and we'd be happy to talk to you. Thanks so much. Have a great day.